European Brain Council is promoting brain research and brain health in Europe. And in doing so, it's continuously demonstrated and worked on the societal impact of brain disorders on our society and on our economies. This is how in 2011 a study was released on the cost and burden of brain disorders in Europe. This is a study that estimated the cost of managing brain conditions every year to approximate 800 billion euros. But what we felt was even more important to try and capture was the cost and impact of non-treatment. And this cost of non-treatment became the value of treatment project that we know.
Value of treatment for brain disorders is a health economics and outcomes research project which addresses brain disorders. The project was initiated and is coordinated by the European Brain Council. Building on the first round of case studies, a second set has now been developed on rare neurological diseases, in particular on ataxia, on dystonia, and on phenylketonuria, and on mental disorders, including anorexia nervosa, autism spectrum disorders, and major depressive disorder.
Before VOT started, decision makers, politicians, and healthcare providers argued on the costs of disease, of diagnosis, of care, of therapy. This means they analyzed what amount of money was spent in the health system. Now VOT turns the mindset upside down. VOT analyzes what money is wasted by not treating, wasted by treating people wrongly, and wasted by not putting enough money into research to improve healthcare. Or in simpler terms, how much money can be saved, think about it, if you implement the already available medical knowledge uniformly throughout Europe, with the result of healthier citizens and healthier workforce.
In terms of rare brain disorders and brain disorders generally, there is a potential huge costs in terms of the treatment costs, both faced by the health service and also by patients and families, and there's potential for capacity to benefit. And I think the economic analyses are quite important, and I think previously often been overlooked.
UK survey strongly indicated that the specialist centres provide a better care and management for patients with very complex and rare diseases. And the management and the care plan organized by the specialist centers then can get roll out in primary care.
The synthesis of all our results will somehow that we should to improve research. Possibly we could improve prodromal diagnosis, intervention, integrated care planning, and as a solution to address value of and based healthcare in Europe and to access the best treatment available all around the Europe.
The inclusion of case studies on phenylketonuria or PKU, an inborn error of metabolism, is timely in light of the introduction of novel therapies, including an oral pharmacologic chaperone and recombinant enzyme formulation beyond just dietary manipulation. And it is through examination of outcome and the health economics of patient care for individuals with PKU that our engagement with VOT2 project under EBC, or the European Brain Council, gives us reason to be optimistic that our patients' voices will be heard on this occasion.
There are many people out there that think that PKU care is sorted, that people live a good quality of life. That's not the case. There is much that we can do to improve the treatment options. There is much we can do to improve the patient pathways. This is a golden opportunity to get things right for our patients with PKU. Let's give them the best quality of care and let's improve the quality of life.